Okay, so good afternoon, everyone. My name is Dory Horn from the New England QIN-QIO, and I will be your moderator for today's webinar, The Truth About E-Cigarettes. Thank you for joining us. Before we get started, just a few housekeeping items. This call will be recorded for training purposes and will be uploaded to the event webpage within the next 3 to 5 business days. I will provide you on details on how to get your questions answered at the end of this webinar. And at this time, I would like to introduce our speaker for the day. Dr. Brian King is the Deputy Director for Research Translation in the CDC's Office on Smoking and Health. Dr. King has worked for over a decade to provide scientific evidence to inform tobacco control policy and to communicate this information to stakeholders. And at this time, I'll pass it over to Dr. Brian King.
Excellent, thank you. So it's my sincere pleasure to be here today to talk about the truth about e-cigarettes. And of course, e-cigarettes are the topic du jour in the public health discourse right now, and there's a lot of questions about these products. And, the bad news is that, the science is still emerging and there's still a lot that we don't know, but the good news is that we do know enough to act. And so today I'm going to give you a brief overview of where we sit in terms of the available science of these products, including patterns of use, the health effects of these products, certain hot topics, including new products such as Juul, as well as some policy options. And the latter is really very critical because it's one thing to say that we know the risks of a certain health risk factor, but most importantly, it's critical to do what we know works to effectively minimize risk on the population level. And so those policy options are going to be particularly relevant for us today. So without further ado, I'll get started on patterns of use. So in the United States, we have made considerable strides in terms of reducing cigarette smoking among adults and youth in this country. Since 1965, cigarette smoking has been coming down among adults, and among youth, cigarette smoking has been coming down since the mid-90s, which is showcased in this slide. And this is really a commendable public health achievement for which we've made significant strides in recent years. However, what we don't want to be doing is playing what I call a game of public health whack-a-mole, where we allow certain products to go down and other products to go up. And we do know that there's a diverse array of tobacco products that currently are being used by the American public, and some of those are listed here. And basically what we're going to be speaking about today is the electronic nicotine delivery systems, or ENDS, which are commonly referred to as e-cigarettes. And I'm also going to briefly touch on heated tobacco products as well, which are kind of the next wave of products that are entering the U.S. marketplace. And so although we know that there's a lot of different tobacco products that the American public is using, we also know that there's also a lot of volatility and change even within the different tobacco product types. And e-cigarettes are a great example of that. And this slide is an infographic that presents the different types of e-cigarettes that are available in the U.S. market. And so you can see on the far left, e-pipes and e-cigars are examples of products that mirror the size and shape of traditional products. But then towards the further right, we start to see more variation in terms of e-cigarette products. And so the large size tank devices are often called mods or tanks. And those are the larger e-cigarettes that you're going to see sold at vape shops. And those give the user the most latitude to modify the product and to the nicotine concentration or the flavor preferences of their choice. In the middle, you're going to have the mid-sized tank devices, the rechargeable or e-cigarette devices. And Juul is a type of rechargeable e-cigarette. And so basically with these products, you recharge the device, but you replace the pod with the flavor or whatever nicotine concentration that you prefer. And on the far right, we have the disposable e-cigarettes, and these are the same size and shape and feel as a conventional cigarette. And typically we see e-cigarette users start with these products, and then they graduate into the rechargeable or larger tank-style devices. So in terms of the patterns of use of e-cigarettes in the United States, this slide presents estimates among adults. And it's separated out by whether they are current, former, or never cigarette smokers. So this is people who have ever used an e-cigarette. And you see that we saw a marked increase in the use of e-cigarettes up until about 2015, and then things started to plateau. But for the most part, e-cigarettes are most commonly used among current and former cigarette smokers when it comes to adults. And so this slide really presents that. We have about 6% use among never smokers, which is important not to dismiss that number because we know that 6% of never smoking adults is still millions of people who are being exposed to nicotine and other harmful ingredients in these products. You'll note that there are some dotted lines in this current graph, and that's just because we changed the survey over time to better capture the products that people are using. And so just as the e-cigarette landscape is changing, so must we when it comes to surveillance. And so ultimately, these most recent estimates that are presented in 2017 reflect the most current language that we've used to assess e-cigarettes in the United States. So now let's move on to current use. And so this slide presents current use or everyday or someday use of e-cigarettes in the United States. And you can see here that there's an overall estimate of about 3% of U.S. adults currently use e-cigarettes. And we do see a decline in the use of e-cigarettes as people get older. So it's higher among younger adults, 18 to 24, and then goes down as you get into middle-aged adults, and finally it's the lowest among adults aged 65 or older. It's also important for us to look at the combination of e-cigarette and cigarette smoking. And so this graph presents this issue of dual use. And this is a big issue in the public health discourse because in order for e-cigarettes to have a benefit among smokers, they have to quit completely. And so if they're continuing to use both products, then that's not going to yield a significant public health benefit to those individuals. So if you look at the white bars in this graph, it shows dual use. So the percentage of current adult e-cigarette users who are currently smoking cigarettes. And based on this graph, that's at 60%. So 60% of adult e-cigarette users are also currently smoking. And so that's a concern for us because in order to benefit, you have to transition completely to e-cigarettes and not continue using both. What's also interesting in this graph is the proportion of never cigarette smokers, which are identified by that dark blue bar. And you see that overall about 10% of adult e-cigarette users have never smoked a conventional cigarette. But when you separate that out by age, we see marked upticks among young adults. 40% of young adults who are e-cigarette users have never smoked a conventional cigarette. So these are young adults who would not otherwise be exposed to nicotine who now are because of the use of e-cigarettes. And so that's why when we message around public health concerns of these products, we're also talking about young adults in addition to youth. So speaking of youth, here is the data patterns of use among youth in the United States. We saw an exponential increase in e-cigarette use among youth, 900% from 2011 to 2015. And then it declined for the first time in 2016, as denoted by that pink bar on this graph. And then it kind of plateaued into 2017. There was a slight uptick, but it wasn't statistically significant. We do believe, based on retail sales data, that the introduction of new products such as Juul could change this in 2018. Specifically, we saw marked upticks in the sales of Juul in the summer after this particular survey was fielded. So it's very possible that for the 2018 wave of the survey that we're poised to see considerable increases in the use of e-cigarettes among our nation's youth, which would backtrack on the progress that we've made into 2016. And so we're eagerly awaiting the release of those 2018 data to see what the most recent patterns of use are among youth. But for the most part, you can see that it's been a very volatile landscape when it comes to e-cigarettes, and these products are indeed now the most commonly used tobacco product among U.S. youth. But when we're looking at use, it's also important to look at frequency. And so this slide presents frequency of use of e-cigarettes among middle and high school students who have used the products in the past 30 days. And so from here you can see that about half of youth are using the products 1 or 2 days within the past 30 days, and about close to 10% of high school students are using all 30 days. Frequently people try to discount this by saying, well, most of the kids are not using the product every day, and so that's not a problem. But we have to remember that most youth tobacco users do not use the product every day. patterns of use are not similar to adults. So most youth cigarette smokers are not smoking the product every day. So we don't want to make exceptions for e-cigarettes that we would for other products. And the bottom line is that, all routine users were at once intermittent users of these products. And so when it comes to use, it's really critical that we prevent all types of use, including experimentation of e-cigarettes. So now let's move on to the health effects of these products. In terms of the potential health benefits at the population level, the Surgeon General's report in 2014 broached this issue very carefully. We didn't have a lot of data on e-cigarettes at the time this report was released, so it really was set up along the theoretical of what the potential benefits and risks of these products are. And so we basically acknowledge that there could be benefits for some adult smokers, but on balance there could also be potential health risks of these products as well. And since the release of that report in 2014, we're fortunate there's a breadth of scientific data that has been released on these products, which has better helped us capture what the ultimate potential health benefits and potential health risks of these products are. So when it comes to the benefits of these products, this slide presents the fact that there can be benefits, but only under certain circumstances. And those certain circumstances largely have to do with the complete transitioning of adult smokers from cigarettes to e-cigarettes. So if an adult smoker were to quit for good and completely transition to e-cigarettes, there would be a net benefit. Of course, that's not necessarily what we're seeing in the data. About 60% of them are dual users, and that's a concern because cutting back is not enough. Even smoking a few cigarettes per day can have significant health risks and even double the risk that you'll die from coronary heart disease as a result of smoking. So the best course of action is to quit completely, and if e-cigarettes are going to have that benefit, they have to help adult smokers quit completely. And as we'll discuss later, the science is simply not there to recommend e-cigarettes for cessation purposes based on the available science. That being said, there's also significant health risks of e-cigarettes at the population level. And so these are the 7 major buckets that I'm going to walk you through slide by slide in terms of the potential health risks of these products at the population level. And so we'll start with the gateway issue, and there's potential public health concern if these products lead to the initiation of combustible tobacco use among non-smokers, particularly children. And so the Surgeon General's report in 2016 on e-cigarettes broached this issue very carefully, and basically it concluded that there was a strong association between conventional cigarette smoking and e-cigarettes. And that's because at the time we only had about 6 longitudinal studies, and that means studies that follow the same kids over time. And so it wasn't possible for us to make a strong scientific conclusion beyond just saying there's a strong association. But the National Academies released a report earlier this year that was able to capture some of the more recent science that was published on this issue and had a stronger conclusion saying that there's moderate evidence that e-cigarette use increases the frequency and intensity of subsequent combustible tobacco smoking among kids. And so basically what the science is showing us is that kids who use e-cigarettes are more likely to smoke conventional cigarettes in the future. However, you have to look at the magnitude of the estimate. So, is every kid who uses an e-cigarette going to go on to cigarettes? The answer to that is certainly no. But there is one more concern about the use of e-cigarettes, and that it could lead to smoking among kids. And it really just reinforces the fact that we don't want kids using e-cigarettes, period. But one more, egg in the basket of concern is that these products could lead kids to mental smoking as well. Another concern is relapse among former adult smokers. So if an adult smoker were to quit, that e-cigarettes could lead them to go back to conventional cigarette smoking, and there is some data to suggest that's the case. Specifically, data nationally among adults that was published in Preventive Medicine found that among former smokers, e-cigarette use was associated with greater odds of smoking relapse, 1.5-fold higher odds. And so this is a potential concern, although we need more data in this realm to better make stronger conclusions about whether that's actually the case. One of the more notable concerns over these products is that it's going to diminish the chances that a smoker will quit. And so presently, we do know that some people are quitting using e-cigarettes, and that's a good thing. We want people to quit smoking. But, you know, a lot of those are anecdotal reports, and the plural of anecdotes is not data. And right now, the randomized clinical control trials, as well as those longitudinal studies, have very mixed results. Whereas some are showing e-cigarettes are helping people quit, others are showing e-cigarette users are less likely to quit, and some are showing no effect. And so we ultimately do need more science on this issue. The National Academies report that I mentioned earlier found that there was insufficient evidence to recommend e-cigarettes for cessation, and that's consistent with the two Cochrane reviews that have been released, as well as the recommendations of the U.S. Preventive Services Task Force. And so right now we just do not have the robust science showing that e-cigarettes help people quit, but on balance there is some emerging studies showing that people who use certain types of e-cigarettes may be more likely to quit. So specifically people who are using larger tank-style e-cigarettes that have greater nicotine yield may be more effective to help people quit than the most small or disposable variety e-cigarettes that don't give sufficient nicotine to the user. So another concern is that these products may discourage smokers from using proven quit methods. And this is a study that was released by CDC last year. And you can see that in terms of the use of FDA-approved medications such as Zyban and Chantix, it's about 12%. And the nicotine patch is about 25% of people who have made a quit attempt. But on balance, you see a lot of use of e-cigarettes. So switching completely to e-cigarettes about 25%, which is the way they tried to quit, as well as substituting some regular cigarettes with e-cigarettes is about 1/3. And so the rates of e-cigarette use are actually higher than the proven recommendations and tools such as medication that we know are effective to help people quit. And so this is a potential concern that people are using unproven ways of attempting to quit as opposed to those interventions such as counseling and medication that we know can double the likelihood that a smoker will quit completely. Another concern related to e-cigarettes is exposure to e-cigarette aerosol. The Surgeon General in 2016 concluded that e-cigarette aerosol is not harmless. It can contain harmful and potentially harmful ingredients, some of which are noted in this slide. So things like nicotine, which we know is not risk-free among kids, volatile organic compounds, ultrafine particles that can be inhaled very deep into the lungs, cancer-causing chemicals, heavy metals such as nickel, tin, and lead, as well as flavorings such as diacetyl, which is linked to a chemical linked to a serious lung disease. And so we do know that this aerosol that comes from e-cigarettes is not harmless. It does have lower risk than conventional cigarette smoking, but remember that that's a pretty high bar when it comes to health risks. Cigarette smoke has 7,000 chemicals and 70 carcinogens. So most things are safer than conventional cigarette smoke, and when we're talking about clean indoor air standards, no exposure to any tobacco product emissions is really the best standard to protect public health. So another concern related to e-cigarettes has to do with advertising. And this slide presents some of the ways in which e-cigarettes has been glamorized or renormalized tobacco use at the broader population level. And so the Surgeon General concluded in 2016 that e-cigarette advertising uses many of the same themes and tactics that have previously been shown to promote cigarette smoking among kids. And these are just a few examples, including a strategically placed bikini line ad for blue e-cigarettes, as well as the recurring themes of sex and rebellion and independence. And so this is ultimately concerning to us because we know that advertising can influence kids to use tobacco products. And right now, about 4 in 5 U.S. youth report being exposed to e-cigarettes. And these are data from the CDC that shows the exposure to e-cigarette advertising has actually increased between 2014 and 16. And the retail stores, the most commonly exposed area for kids, followed by the internet, and then television, which are about 40%, and then newspapers and magazines are about 24%. And some of these areas are places where conventional tobacco product advertising is banned. So, for the case of television, cigarettes has not been able to be advertised since the 1970s, and smokeless tobacco has not been able to be advertised since the 1980s. So we have a novel mechanism in television to promote e-cigarettes, and we're also seeing marked advertising on the internet, including through social media. So another concern related to e-cigarettes is the results in poisonings among users or non-users. As I noted before, the nicotine in these products is, not risk-free, and at certain levels, nicotine can be toxic. And so back in 2010, we saw about 1 or so calls a month nationally on e-cigarette poisoning. And by 2014, that was in excess of 400 calls per month. And by the end of 2014, we had about 4,000 calls to poison control centers as a result of e-cigarettes. And what's most concerning is that half of those calls were for kids less than 5 years of age, who had either ingested the liquid or otherwise been exposed to the products. And this really reinforces the importance of ensuring that particularly young kids and infants are not exposed to these products. There was one death in upstate New York of a child who ingested the e-cigarette liquid, and also a suicide where an adult, injected the e-cigarette liquid directly into their bloodstream, and they were ultimately killed because nicotine at very high levels can be toxic. So you'll note that nicotine is a major messaging point from the CDC and others, and that's because we do have a strong body of evidence showing that it's harmful to the health of certain vulnerable populations, particularly kids and pregnant women. And this slide presents the major conclusions from the 2016 Surgeon General's report that noted that nicotine exposure during adolescence can cause addiction, and it can also harm the developing adolescent brain, specifically the prefrontal cortex and the formation of synapses that are responsible for learning and cognition and memory. And remember that the developing brain, it continues through young adulthood and about age 25. And so, any assaults on the brain during that period from psychoactive substances, including nicotine, can be detrimental to the long-term health of youth. We also know that nicotine can lead to fetal toxicity, and so pregnant women should not be using nicotine-containing products unless in close consultation with their healthcare professional. And as I noted before, ingestion of e-cigarette liquids containing nicotine can cause acute toxicity and possibly death if the contents of refill cartridges or bottles containing nicotine are consumed. And that's particularly concerning for young children and infants. So in terms of the nicotine content in e-cigarettes, it's important to really do a deep dive in terms of the source of data on this issue. And the year before last, national data from the National Institute of Drug Abuse published some self-reported data from kids on what they were using in e-cigarettes. And it basically found that about a quarter of kids reported using nicotine in their e-cigarettes. And so a lot of people pounced on this and said, well, this shows that most kids aren't using nicotine in e-cigarettes, so this isn't really a public health problem for us anyway. The kids aren't using these products that contain nicotine. And that was puzzling to several individuals because we know that the intent of e-cigarettes is to deliver nicotine, and that's the primary ingredient of most of the products. And so we thought at CDC to look at it through a different lens, and so we went to retail sales data. And these are data that you can purchase from companies such as Nielsen, which is the same companies that monitor viewership of things like sporting events. They report on the millions of people who watch a certain, program on television. Well, they also record sales of products that are scanned at retailers, including the UPCs of these products. And so CDC obtained the data from Nielsen related to sales of e-cigarettes, and based on the UPC, we were able to link to the reported content, the nicotine content of those products. And what we found was that 99% of the e-cigarettes sold in the United States contained e-cigarettes. So this notion that 80% of our nation's youth are somehow finding 1% of the market share simply doesn't make sense. It's questionable whether youth know what nicotine is, let alone whether it's in the tobacco products they're using. And we've seen a lot of data as of late, particularly around Juul, showing that kids are not aware of the ingredients of e-cigarettes, particularly when it comes to e-cigarettes. 2/3 of youth are not aware that Juul always contains nicotine. So another issue to consider around the ingredients of these products is the flavors. And a lot of times flavors are deemed by the FDA as being generally recognized as safe or GRAS. But this only applies to ingestion of flavors. So these flavors are acceptable for food, but that doesn't mean that they're necessarily safe to inhale. And the gut can handle a lot more than the lungs. And the gut also has an exit strategy, which isn't necessarily the same luxury as for the lungs. And so in the context of some of these flavors, we don't know what the long-term health risks of inhaling these flavors into the lungs will be. And certain things, such as diacetyl, could have long-term and severe health risks among individuals if consumed at very high levels. And finally, in terms of health risks, it's also important to note that e-cigarettes can be used to deliver cannabinoids and other illicit drugs. This is a conclusion by the U.S. Surgeon General. We do know from a recent study released by CDC that 1/3 of youth e-cigarette users in the U.S. report using cannabis or marijuana in an e-cigarette device. And a study out of Connecticut found that about 20% of middle school e-cigarette users reported using cannabis. So 1 in 5 middle school student e-cigarette users were using cannabis. And just think about how young those kids are, 12 to 13 years of age. So the use of nicotine is not the only concern of these products, but there's a broad use of other psychoactive substances, with marijuana being the most notable among our nation's youth when it comes to e-cigarettes. Okay, so let's move on to the novel products in the emerging tobacco product landscape, and we'll start with the volatility of the landscape and the recent emergence of Juul. And so Juul is a USB-shaped e-cigarette that entered the U.S. market in 2015, and it has wreaked havoc in our nation's school system to the point where we've received reports across the country about the use of these products. And we've seen upticks in sales as well. This is a study that was published by the CDC in the Journal of the American Medical Association, which found that since the introduction of Juul in early 2015, sales of these products has increased 600%, to the point where Juul is the most commonly sold e-cigarette in the U.S. as of 2018. Early 2018, and since this time, it's now commanded 70% of the U.S. e-cigarette market share. And so these products are certainly popular. The sales data don't show us who's using them, but we do have an emerging body of questionnaires among youth and young adults that suggest that many of these users are youth. We see that about 8% are past 30-day users and 10% of youth have ever used the product. And this similarity between these estimates is concerning to us because it suggests that most kids who have ever tried Juul are continuing to use it. And typically when it comes to e-cigarette data among kids, we see far marked variability between these estimates, to the point where 30-40% have ever tried an e-cigarette, but 10-12% are currently using it. So the fact that a large proportion of U.S. youth are not only recognizing Juul, but also experimenting with it and continuing to use it is a cause for public health concern. And one aspect about these products that is particularly concerning is the use of nicotine salts. And this is a new technology that was introduced by Juul in their patents for these products in 2015. And basically what they've done is lowered the pH of the product to make it more palatable to the user. And so if you think back to your high school chemistry class and the pH of different things, we know that red is very low pH, and the blue is very high pH or alkaline. And so basically most tobacco products use very basic or alkaline nicotine, and so it's very blue on the pH scale. And we also know that that's very volatile and it can be very harsh to the throat of the user. So basically what Juul has done is lowered the pH of the nicotine to make it more acidic, and that also creates nicotine salt. And this allows it to go down a lot easier and with less irritation to the actual user. And so who is this particularly concerning for? Well, youth and young adults who have never used a nicotine-containing product, but now have a product with very high levels of nicotine that's going to go down a lot easier. And we do know that Juul has among the highest nicotine concentration of any e-cigarette on the U.S. marketplace. And so that, coupled with its broad availability of flavors as well as this high nicotine concentration, is a cause for public health concern. And it's ultimately a recipe for disaster, and that we know that the products are heavily advertised. They're also available in flavors and also have high nicotine content. And I've said this several times before, but the advertising can bring a horse to water. The flavors will get them to drink, and the nicotine will keep them coming back for more. So finally, in terms of novel products, I also did want to mention heated tobacco products or heat not burn products. The CDC calls these heated tobacco products because we're not yet convinced that burning does not occur. But basically, these products are electronic products, so they're similar to e-cigarettes, but they don't use a liquid. They actually use tobacco. And the product itself is a mini cigarette, which is then pierced by a metal blade in the electronic device. But this then heats the tobacco as opposed to burning it like a conventional cigarette. And so it provides the same throat hit as a conventional cigarette, but manufacturers of these products claim that it isn't as dangerous as a conventional cigarette because there's no combustion or burning. And so you can see one example of these products, which is IQOS in the bottom right-hand corner. And this is from Philip Morris, and all the major tobacco companies are now shifting in terms of the products they're selling to include heated tobacco products. And some industry analysts project that these products could displace a sizable portion of the conventional cigarette landscape. And the industry themselves has acknowledged, they've said that regular cigarette smoking is bad, and we acknowledge that, but now we want to offer this alternative of a allegedly less risky product to the American public. So in terms of where we are with the availability of these products, the FDA is responsible for approving these products for sale in the United States. And Philip Morris submitted an application for IQOS. One application was whether they could even sell the product in the United States, and the second was whether they could include a modified risk claim, basically saying that the products are less riskier than conventional cigarettes, and to include that on the package of the product in any advertising. So the FDA convened an expert panel in early January on this topic, and they're currently in the process of deliberating over whether these products will be allowed to be sold in the United States. In the interim, we are collecting some surveillance data. These products are available internationally in several other countries, even though they're not available in the United States. And so we did a study of CDC and found that less than 1% of U.S. adults have ever used a heat-not-burn product. We specifically asked about IQOS in this question. So it's still relatively low rates of use, but of course that could change as the products enter the marketplace and are more readily available for sale and use in the United States. So this could be the next frontier when it comes to tobacco products in the United States, and it's important for us to keep our pulse on the changing landscape, not only for the actual use of these products, but also what the health effects are and how they can be broached in terms of both research and policy implementation. Okay, so when it comes to the potential benefits and risks of these products, it ultimately comes down to the balance of public health benefit or harm. And youth initiation, of course, would introduce a harm, and adult cessation would ultimately create a benefit. But it's important to make this distinction when we're talking about public health policy, planning, and practice. And when it comes to youth, the 2016 Surgeon General's report really put this issue quite nicely when it advocated for the precautionary principle to protect youth and young adults from adverse effects related to e-cigarettes. And although there could be a potential benefit of these products among adult smokers, that can't come at the expense of our nation's youth. And so in order to minimize potential risk at the population level, there's multiple options for evidence-based strategies to reduce those risks at the population level. And so we're doing a decent job of educating youth about these products. These are data from the National Youth Tobacco Survey that shows that about 2/3 of U.S. middle and high school students believe that e-cigarettes cause some or a lot of harm. There's about 10% that causes no harm, and about 25 to 30% who say a little harm. And so we have done a decent job about educating kids about the risk of e-cigarettes, but we still have a ways to go. Of course, most kids know that regular cigarette smoking is dangerous, but it appears that there's still a bit of a knowledge gap when it comes to these newer tobacco products, including e-cigarettes. On balance, aside from the issue related to youth initiation of products, there are several people who actually advocate for a harm reduction approach. And basically, harm reduction is a proposed strategy to lower the health risk to individuals in society by transitioning combustible tobacco smokers to products with relatively lower health risk. And so, combustible tobacco products are responsible for the overwhelming burden of death and disease from tobacco use. And then non-combustible products such as smokeless tobacco and chew and dip and snuff would be somewhere in the middle, and then these electronic products would be the less risky. And so some people believe that if we were to transition society to these lower risk products, that there would be that net public health gain, which could occur if people were to transition completely, but presently we don't have sufficient scientific evidence to show that that is actually the case. We do have some knowledge gaps when it comes to adults in terms of e-cigarettes. We know from the available scientific evidence that e-cigarettes are less risky than regular cigarettes. It doesn't mean they're harmless, but they do have less risk. But presently there's a lot of uncertainty in the American population. Only 1/3 of American adults believe that e-cigarettes are less harmful, which is the accurate answer. Well, about 1/3 believe they're about the same. 4% actually believe e-cigarettes are more harmful, and about 1/3 don't know. So though we've made some great strides among kids, we still have some education to do among American adults in terms of the risk of these products. But on balance, we have to be very mindful of the fact that in order for e-cigarettes to have a benefit, you have to quit completely. And right now, the science on the efficacy of e-cigarettes for accomplishing that is still very much uncertain. Okay, so I'm going to end with the policy options. And as I noted before, it's very important that we acknowledge the public health risks of tobacco products. But we also have to let people know what they can do about it in order to effectively address these risks. And so to kick off this component of the discussion, I'd like to start with the tobacco control vaccine, which is something that I have been harping on for the better part of a decade to anyone with a pulse. And it really gets at this issue of population-based strategies. And over the years, people have come to me saying, wouldn't it be great if we had a vaccine that we could give to people that would prevent them from becoming addicted to nicotine? And there are some people working on that in the clinical space. But my response is always that we have our vaccine at the population level when it comes to tobacco control. And if we were just to implement these strategies, we could prevent a lot of tobacco-related disease and death. And we know that 9 out of 10 adult smokers start before the age of 18, and 99% start before young adulthood. So if we inoculate the population with these prevention measures and denormalize the use of tobacco use, we're going to have a significant impact in terms of preventing future adult use of these products. An ounce of prevention is worth a pound of cure. And we know from tobacco use in general that prevention is really the key lever to prevent use among future generations. And the same holds for e-cigarettes as it would for conventional cigarette smoking. And there was really a strong basis for this outlined in the 2016 Surgeon General's report, in noting that action can be taken at the national, state, local, tribal, and territory levels to address e-cigarette use among youth and young adults. And those actions could include a lot of those tried and true interventions that we know work for conventional cigarettes that would also work for e-cigarettes, including preventing access by use, price and tax policies, retail licensure, regulation of e-cigarettes, including them in smoke-free policies. So it's not really a matter of us reinventing the wheel here so much as greasing the squeaky wheel to ensure that our policies address the diversity of tobacco products that the American public is using. And so at the national level, the FDA was given the authority to regulate tobacco products in 2009, and we have seen several strides that have been taken by the FDA since that time, including bringing e-cigarettes under its jurisdiction in 2016. But it's important to note that FDA has the authority from Congress to regulate the manufacturing, marketing, and sales of tobacco products. And so that doesn't include all things, such as including e-cigarettes and smoke-free policies, pricing strategies and taxation, or increasing the age of sale beyond age 18. But an important component of federal regulation is that it doesn't preempt states and localities and territories from implementing many strategies. And so there's a lot of potential subnational action that can take place, including several of those listed here that I've already mentioned. And so we know that tobacco control for many decades has thrived off of the galvanization of local and state action, which has then kind of percolated up to a broader level after social norms have changed and people have understood the risks of products and public support has increased. And so we ultimately expect to see something similar to e-cigarettes, and that, local and state action is critical to percolate different policies and population-based understanding, which in turn goes and percolates higher to the state and national level. So in terms of federal action at this point, there's several new manufacturer requirements that the FDA has implemented when it comes to e-cigarettes, some of which are listed here. It is important to note that some of these actions have been delayed by the current administration. That tends to happen when you have transitions between different administrations at the federal level, where the incoming administration wants to better understand different regulations and policies. So that's not to say that these things aren't necessarily going to happen, and some of them already have, but there is currently a delay for several actions as the FDA considers the best approach for moving forward. But it is important to note that a lot of these are very common sense strategies, and many of which have already been implemented, including implementing 18 as the minimum age of sale for e-cigarettes, as well as some other components related to manufacturing, marketing, and sale of these products. But there's also a lot of great progress being made at the state and local level, and as I noted earlier, including e-cigarette and smoke-free laws is a key example of that. We now have 10 states and D.C. that have done this nationally, as well as 500 communities at the local level across the country have included e-cigarettes in their smoke-free policies. But the states that are noted in the lighter blue do not currently include e-cigarettes in their smoke-free policies, and most of the country, about 40%, don't even have a smoke-free law at the state level to address cigarettes. And they also don't include e-cigarettes. So we've still got a ways to go in terms of protecting the public from not only cigarette smoke, but also e-cigarette, aerosol, and indoor public environments. Another key lever is increasing the age of sale for tobacco to 21. And so there's now 6 states, as well as over 340 cities and counties that have increased the age of sale for tobacco products to 21. The FDA cannot do this. They can only go to 18. And so this is really one of those key policy levers where you can see a lot of great progress at the state level, and which we have seen in the past couple of years. And it is important to note that this isn't necessarily something that's new. The first community to do this was Needham, Massachusetts, back in 2005. So 13 years ago, and since that time we've seen great progress, particularly in the state of Massachusetts, but now statewide policies in half a dozen states to increase the age of sale for tobacco 21, which again is really key at getting into that young adult demographic, because we know that if we can prevent both youth and young adults from starting before age 25, we could basically negate the next generation of adult tobacco use. And so prevention is really key among youth and adults. So in closing, I just want to acknowledge that I'd be remiss if I didn't acknowledge the fact that there's a lot of population-based hurdles. And it's very easy to say that, something is a problem and these are things that we can do about it. But there also are several things working against us. One is that there's an evolving landscape. And so we know that e-cigarettes were not the latest, the first new tobacco product to enter the landscape, and they most certainly will not be the last. Including heated tobacco products. And so it's important that we remain mindful of our research and policies that they address the diversity of tobacco products that are being used. We also know that there's significant disparities related to these products. And if we want to continue to make population-based gains, we have to ensure that we address the diversity of people that are using these products, particularly those with the greatest burden of use. We also know that there's limited resources. The tobacco industry is currently outspending public health 19 to 1 when it comes to tobacco prevention and control. And so it's important that we ensure our resources are bursting the diversity of products that are being used by the American public, and we're not playing that game of public health whack-a-mole. And also, finally, industry influence is very key. We do know that the tobacco industry spends over $1 million per hour in this country to advertise cigarettes alone. And we do know that they are starting to invest more heavily in other new and emerging types of products to replace the income of dollars to their companies. And so, lest we forget that these are adjudicated racketeers that have been convicted in federal court of deliberately misleading the public about the risks of their products. And so as the tobacco industry continues to evolve, it's important that we do the same and ensure that our policies as well as our clinical recommendations address the diversity of products as well as the health risks on the population level. So with that, I'll conclude by noting that use of tobacco products in any form, including electronic tobacco products, is unsafe. That's the bottom line. There are no redeeming qualities for e-cigarettes among youth and young adults. But on balance, there could be a net benefit of these products. Adult smokers must quit completely, though, to realize the benefits of e-cigarettes. And in the near term, e-cigarettes are not currently an FDA-approved quit aid. And so it's critical that we steer people towards those proven interventions while we continue to monitor the available science on the issue of e-cigarettes for adult smokers. We do know also that the recently electronic tobacco product landscape has diversified to include new products, including jewel and heated tobacco products. So it's important that we keep a pulse on the diversifying landscape in these new products. Finally, as the landscape diversifies, it's critical that we modernize our tobacco control strategies to address to these changes so that we're not playing a game of catch-up and instead can get out in front of these products and ensure that we are informing the public with the most up-to-date science and information for informing public health policy planning and practice. And so with that completes my presentation for today, and I appreciate your time listening. And if you're interested in any additional resources on tobacco use, www.cdc.gov/tobacco, as well as www.ecigarettes.surgeongeneral.gov, which has some great resources on e-cigarettes, including scientific articles, as well as fact sheets and clinical provider cards and parent tip sheets for messaging to kids about the risks of e-cigarettes. So with that, I will sign off, and thank you very much for your time today.
Great. Thank you, Dr. King. If you could please go just to the very next slide, I will finish up with the last few announcements. Okay. If you have any comments or questions, please see Brenda Jensen's contact information presented on this slide. Another reminder that we are also on social media, so please visit us on Facebook, LinkedIn, and YouTube. The PowerPoint presentation today can be found on the event website, which is linked on our very first slide, or by visiting us on Healthcare for New England website under the Events tab. The recording should be up within a few business days, as well as a transcript of this webinar. Thank you again to Dr. King for a very informative presentation, and I hope you all have a great rest of your day.